Hi guys, welcome to the channel. Today we're going to be talking about what will hopefully be everything that you need to know about vitamin D. And so without further ado, let's get into the video. Okay, so what is vitamin D? Vitamin D, which is sometimes called the sunshine vitamin, is actually more of a fat-soluble hormone. And what we mean by a hormone is a long-range signaling molecule that's used in the body. So hormones affect distant cells by binding to receptors in the cells and then changing their gene expression and behavior. This means that as a hormone, the effects of vitamin D are incredibly important for proper functioning of the body. As for your body to be functioning correctly, the individual cells that make up your body must also be functioning correctly. And part of this is having the correct hormone levels so that the cells receive the correct signals. And so what does vitamin D do in the body? Vitamin D is best known for regulating calcium and phosphate uptake in the body, which is essential for healthy bones, teeth, and muscles. But that is not all that it does. Vitamin D affects the expression of more than 1,000 genes in the human body through the vitamin D receptor, or VDR as it is called. VDR is found in nearly, if not all, cells in the body. So vitamin D potentially affects the behavior of every cell in your body. Now there's a long list of benefits that have been suggested for having optimal vitamin D levels, including preventing fractures in the elderly, reducing the risk for metabolic syndrome and insulin resistance, which would reduce diabetes and obesity, improving muscle function, preventing cancer, reducing cardiovascular disease like heart disease and stroke, preventing autoimmune diseases like multiple sclerosis or type 1 diabetes, improving neurodegenerative diseases like Alzheimer's, improving sexual function, improving the symptoms of depression, reducing complications for mother and fetus as well as the newborn, including things like autism, respiratory and autoimmune diseases, and improving immune function, including for COVID-19. With one randomized controlled trial showing that administration of a high dose of calcifidiol, which is the form of vitamin D found in the blood, significantly reduced the need for intensive care unit treatment of patients hospitalized with COVID-19 in the pandemic. Now, what we should note is that many of these suggested benefits from having optimized vitamin D levels have not yet been proven in human studies. However, there's also no downsides that have been reported for having optimal vitamin D levels, so it's really only beneficial. It's just not clear exactly how beneficial. Now, the symptoms of vitamin D deficiency can include mood changes like depression, bone loss, muscle cramps or weakness, bone and joint pain, and fatigue. But really, the only way to know your vitamin D levels is by a blood test, since all of these things can be caused by other things anyway. And these days, you can get at-home test kits, which are quite simple and convenient. You normally just prick your finger on a little provided needle, and then drop a small amount of blood onto a piece of card, and then you send that off, and then you get your results emailed to you. For example, last year, I ordered one test, which was from the NHS Vitamin D test website. That was pretty straightforward to do. But you can also get tests from other places or speak to your doctor and you should be able to get a test in your clinic. If you do get an at-home test kit, then I believe the ones that are analysed by liquid chromatography mass spectroscopy are said to be the gold standard that are more accurate and reliable than the other type, which is immune assays. Okay, so what are the forms of vitamin D? There are two main forms of vitamin D. There's vitamin D3, or co-calciferol, which is the animal form, and there's vitamin D2 or ergocalciferol, which is the plant form. You can get some vitamin D from food, but the main source is from sunlight, in particular from UVB rays. UVB rays form vitamin D3 in the skin by reaction with 7-dehydrocholesterol, which is a molecule made from cholesterol. And UVB rays are highest around midday when the sun is highest. So the higher the UVB, the faster vitamin D can be made. In winter, in places like the UK, the UVB is too low between October and March to really make any kind of significant amount of vitamin D. Now, studies show that if supplementing you're getting from diet, then vitamin D3, the animal form, is the best form to take rather than D2, the plant form, as D3 has been seen to be more effective at raising blood levels, despite a smaller dose of D3 in the experiment compared to D2. Vitamin D is stored in the body's fat tissue, and the vitamin D from food, sunlight, or storage in fat is transported to the liver and converted to calcifidiol, or 25-OH vitamin D, which is the major blood form of vitamin D and is what is measured on a blood test. Calcifediol in the blood is converted to calcitriol by the kidneys, and this is the active form of vitamin D that's transported around the body and regulates the behavior of cells. Okay, so now we have a good understanding of what vitamin D is and what it does. So how much vitamin D do we need? Well, about 1 billion people worldwide have vitamin D deficiency, which is classed as blood levels less than 25 nanomoles per litre. And these are very low levels that can cause rickets in children or osteomalacia, which is a similar bone condition in adults. While 50% of the population is thought to have vitamin D insufficiency, which is classed as levels between 25 and 50 nanomoles per litre, which are low levels, but they're not low enough to cause rickets. In northern countries like the UK, this figure is even higher, with 30 to 40% of the population being deficient in winter, and with the majority of the population having vitamin D levels that are insufficient or below. And so we can see this is a very large problem. Of course, we know our ancestors would have evolved near the equator and spent large amounts of time outside in the sun. So this is really a problem of either living too far north, not being outside enough, or covering up too much skin. And we should also note that those with darker skin are more likely to become vitamin D deficient when in northern countries. Also, because the insufficient levels are not low enough to cause rickets, does not mean that these levels are optimal and can't cause other issues. And just as a side note, there's two main units that are used for vitamin D concentrations. These are nanomoles per litre and nanograms per mil. And so if you want to convert between those two, you just divide the concentration in nanomoles per litre by 2.5. Okay, and so all this begs the question, what are the optimal levels? To answer this question, we need to look at populations of humans who live a traditional hunter-gatherer lifestyle, spending a lot of time outside and in the sun, and near the equator where UV is high all year round. Thankfully, such tribes do exist, including the Maasai in Kenya, which are pictured on the left, and the Hadza in Tanzania, which are pictured on the right. And their blood vitamin D levels have been measured previously. The Maasai had a vitamin D level of between 60 to 170 nanomoles per litre, and the Hadza a level of 70 to 170 nanomoles per litre, which is quite a large range of values, and the top vitamin D levels in the range are much higher than the range of insufficiency. Another study suggested that the optimal level for human physiology is around 100 to 130 nanomoles per litre, or 40 to 52 nanograms per mil, and this is similar to those seen in the hunter-gatherers. And for breastfeeding, the range required was slightly higher at 100 to 150 nanomoles per litre. And this range was determined as the range that provided enough vitamin D in the breast milk. They also estimated these blood levels would require an input of around 4,000 to 6,000 IUs, or international units, per day from all sources, including diet, sun, and supplements. Now, getting your vitamin D from sun exposure is probably going to be the best way, but this isn't always possible, of course. Thankfully, studies have shown that supplementing vitamin D is very safe, and one study showed that doses up to 10,000 IUs per day were safe, and another study showed that doses up to 15,000 IUs per day were safe, and blood concentrations up to 300 nanomoles per litre were also safe. And for reference, full sun exposure in a bathing suit for 20 minutes was said in one paper to be equivalent to approximately 15,000 to 20,000 IUs of vitamin D3. Another interesting paper showed daily oral intakes of vitamin D3 ranging from 5,000 IUs per day to 60,000 IUs per day for several years were safe, and supplementing 5,000 or 10,000 IUs per day, it took roughly 12 months to reach a stable blood vitamin D level. Blood levels as high as 202 nanograms per mil were observed with 10,000 IUs per day dosing, and up to 384 nanograms per mil for over 10,000 IUs per day. But none of these blood levels caused adverse health effects despite being much higher than the normal range. And the authors say that the use of doses ranging from 25,000 to 60,000 IUs per day was associated with remarkable clinical benefits in several individuals with psoriasis, asthma, and skin cancer, without the development of hypercalcemia, which is elevated calcium levels, or any clinical toxicity. And these findings were also consistent with several case reports in clinical trials. And so it is possible that the lack of support for some of the suggested benefits of vitamin D from modern randomized controlled trials, like is highlighted in this Nature review article, could be due to the small daily doses given in the trials, which are typically 2,000 to 4,000 IU per day, for trials like Vital, Vida, and D2D that the review was looking at. And so the authors of the study, looking at doses up to 60,000 IUs, suggest that new clinical trials need to be carried out that use vitamin D doses in the same range as the body would get from sun exposure, i.e. between 10,000 to 25,000 IUs per day. The authors also suggest that the fear over vitamin D toxicity originates from earlier studies where patients were given hundreds of thousands of IUs or more per day for months, which is far, far higher than one could ever get from the sun. The daily dosage you might want to take depends on multiple factors like your current blood levels, how much body fat you have. As the more body fat you have, then it will take a larger dose to raise your levels. I think this is because vitamin D is stored in the body fat. Studies also suggested that vitamin D supplements are best taken with food for maximal absorption. There's actually vitamin D calculators that you can use on the web, which can estimate how much you should supplement and for how long to get your levels up based on your current levels. But the best way to optimize your vitamin D level is really to test and adjust any daily dosage of vitamin D supplement accordingly. So you take a larger dose if you're trying to increase your D levels, and then you would drop your dosage if you're just trying to maintain your levels through winter or something. And you're really aiming to be in that 100 to 150 nanomoles per litre range. And so I would suggest either using one of these calculators that you can find, which are all based on models and papers, or speak to a doctor to advise on dosages when you can't get sufficient sunlight. So if it's winter, for example. Personally, I take 4,000 IUs every day in winter, but how much you might want to supplement depends on yourself and your current vitamin D levels. If you get a lot of sunlight where you live, let's say you live near the equator, then that's going to be the best way to get your vitamin D, and then you don't need to worry about supplements. Also, getting it from the sun, you can't get too much vitamin D from the sun because any excess vitamin D from sunlight is broken down in the skin. So there can't be any issues there. You can't get too much vitamin D from the sun. Alright, so I hope you all learned something of value in that video. And if you like the video, then do the usual YouTube stuff, like, comment, share and subscribe. And if you want to support the channel, you can do so on PayPal or buy me a coffee. And as we're getting into spring in the Northern Hemisphere right now, for the next video, we're going to be talking about sunlight and the benefits or downsides of sun exposure, and not just in terms of vitamin D. So thank you for watching.